Hi everyone. So in today's video we are going to deal about an important topic called portal vein, which is seen in the abdominal region. So portal vein, we are going to deal with some specific topics which are very important to understand under this topic. So first we are going to deal about some general features of portal vein. So first we will deal with general feature. And then we are going to deal with some peculiarities of this portal vein. And then we are going to deal about the formation of this particular portal vein. And then we are going to talk about the important communications of this portal vein with systemic vein. Communication with systemic vein, that is nothing but inferior vena cava. So about these things we are going to deal. So along with that we are going to talk about the tributaries. So once you know the tributaries of portal vein, then it will be easy for us to understand about the communication of this portal vein with the systemic vein. So now we are going to get into this topic, portal vein. So to talk about portal vein, we have got this portal vein, which is a separate system of venous drainage seen in the abdominal region. So we have got two systems of venous drainage in abdominal part. One is by systemic veins and other one is by portal vein. First we will get to see some general features of this portal vein. So we are going to deal with general features. So to talk about the general features, we will see some particular ones alone. We are not going to much detail of this portal vein. The general features are, it is going to drain the blood from abdominal part of alimentary tract. So you know we have got alimentary tract starting from esophagus to the rectum region. So that abdominal part, so abdominal part of alimentary system is drained by this portal vein. So draining of this abdominal part of alimentary system is carried out with this portal vein. And then in portal alimentary system, I said it is starting from esophagus till the rectum. So here what will happen is, except the lower part of rectum and anal canal, it is going to drain all the other parts of alimentary system. So this is the important thing we have to consider, that is in alimentary system we have got from esophagus to rectum and anal canal and some more parts such as liver, pancreas, spleen, duodenum. We have got such parts seen in this alimentary system. So whole of it is drained by portal vein except two regions such as lower part of rectum and that of anal canal. And then it is also going to receive, other than alimentary system, it is going to receive also from, as I said, spleen, pancreas and liver. So these are the other regions which is also getting drained into portal vein. And then we have got these veins which are uniting together to form the portal vein. So the veins coming from splenic, pancreas and liver, which is joining with the veins continuing from the alimentary system, together will join the portal vein. So all the veins together, it is going to join and form the portal vein. And this portal vein, it is going to circulate in liver. At last it is going to end up in liver. So in liver we have got a part called porta hepatis. So in that porta hepatis it is going to end up and then it is going to form a circulation over there. At last from the circulation of liver it is going to get drained itself into IVC, that is inferior vena cava. So inferior So in the inferior vena cava it is going to get drained. So this is the general features of portal vein which we have to consider. So portal vein, it is formed by the veins draining the alimentary system and also the spleen, pancreas and liver, which are together going to join the portal vein, which is at last entering into liver, and from the liver it is going to get drained into inferior vena cava, which is a systemic vein. So these are the general features you have to know before understanding the descriptions of portal vein. Now we will move on to peculiarities of the portal vein. So compared to other veins in our body, the portal vein have got some peculiarities which is different from the other sort of venous drainage. So we will get into the details of the peculiarities of this portal vein. So first peculiarity of this portal vein is, it is a vein which is going to begin as like veins. So begin like veins, but it is going to end up as arteries. So the structural difference will be seen, such as the beginning of the portal vein will be having the features same like of veins, but while it is ending up in the porta hepatis, it is going to give branches same as like the feature of arteries. So then we have got venous blood. Usually along with the venous blood in portal vein, we have got some absorbed particles of food also, digested food also will be seen along its course. So absorbed food materials, food will also be seen in the portal vein drainage. Usually veins, it will have the venous blood flow. So in the blood flow we have got absorbed food particles which is also passed through this portal vein distribution. And in portal vein we have no valves. So it is devoid of valves and it is considered as a reservoir of blood. So portal vein is also considered as reservoir of blood. Why? Because in our total body we have got 1/3 of entire body blood passing through this portal vein. So entire blood of our body will pass through this portal vein. So these are the important peculiarities we have. And then I said we have got this portal vein. If we are taking it as, so this is the portal vein, consider. So this portal vein, again it is formed by two formative tributaries. So this is, I will tell you again later. So this portal vein, at last, while it is, that is, we have got this portal vein formed by two veins, that is splenic vein and superior mesenteric vein. So it is, while getting formed, it is forming like veins. But while it is getting entered into the liver, it will give some branches. So we have got branches of portal vein entering into the liver. So we have this superior mesenteric vein which is going to pass the blood through the right branch, and in splenic vein the blood which is carried from the splenic vein passes through the portal vein and then it is getting entered into left branch. So this is how the peculiarities of portal vein are distributed. So I will once again summarize peculiarities. It is going to begin as arteries and end up in a pattern like of arteries. Begins like veins and end up in a pattern like arteries, such as it is giving some right and left branch. And along with the venous blood, it is going to carry some absorbed food particles also. And it is devoid of valves. It is considered as reservoir of blood because it is going to carry 1/3 of our entire body blood. So these are the sum of peculiarities. Now we will move on to the actual anatomy of portal vein, that is its formation, distribution and their communication. So now we are going to deal about the formation of portal vein, that is the actual anatomy of portal vein in detail we are going to see. So as I discussed before, the formation of portal vein is mainly because of two veins, that is splenic vein and superior mesenteric vein. So these are the two veins which are responsible for the formation of portal vein. So portal vein, it is formed by combination or union of splenic vein and superior mesenteric vein. So this portal vein is situated where we have to see, so such that we can make out the splenic and superior mesenteric vein also from where it is coming. So we have got this portal vein as I shown. We have got superior mesenteric vein which is coming from the lower part and splenic vein which is coming from the left area. So from the left side we have got splenic vein which is combining together to form our portal vein. So this is portal vein and this is splenic vein. So here we have got our spleen. So here we will be having spleen. So from the spleen it is going to drain the venous blood and then it is carried towards the right side, and here we have got superior mesenteric vein. This is superior mesenteric vein. So which is seen in the mesentery, that is going to carry the intestinal part. So these two veins are together joining to form this main portal vein trunk. Now we are going to deal the situation of this particular vein. So situation of the portal vein we are going to see. So talk about the situation. First we have got pancreas. So we have got duodenum. So you will be having a knowledge where the organs are present. So we have got duodenum. So we have got duodenum, again first part, second part, third and fourth part will be seen. So in the concavity of this duodenum we have got the pancreas present. So we have got the pancreas region present over here. So this is pancreas. So in pancreas again we have got head, neck, body and tail region. So this is head, this is neck, this whole thing is body and this is the tail region. So now to talk about the situation of portal vein, this portal vein is present just behind the neck of pancreas. So this is the region where we have got portal vein. So in the neck of the region behind the pancreas we have got the formation of portal vein. So this is the portal vein situation behind the neck of pancreas. So this is portal vein. And if you have to see the behind relation of this portal vein, so we have got portal vein. Behind this portal vein we have got some structure, that is inferior vena cava. So the major structure which is present just behind the portal vein is inferior vena cava. So this is IVC, that is inferior vena cava, and this is portal vein. So this is the behind relations. So behind relations, this is front relation. So front by neck of pancreas, behind by IVC, and also we have got vertebra behind the inferior vena cava, and that is L2 lumbar vertebra. So we have got again a vertebra which is related just behind the inferior vena cava, that is L2 vertebrae. So these are the two structures which are present related behind the portal vein. So in front we have got only one structure, that is neck of pancreas. So that's it. So this is all about the formation. It is mainly by splenic vein and superior mesenteric vein which is joining together to form the portal vein, and that is situated in front of portal vein we have got neck of pancreas. Behind the portal vein we have got two structures, one is inferior vena cava and behind that we have got a vertebra called L2 level lumbar vertebra. So that's all about the formation, and we will deal about the relation. So now we are going to deal about the extrahepatic part. So among the two parts, the part which is present outside the liver is considered as extrahepatic part. So this is the extrahepatic part, the part which you are seeing vertically, and the outlines you can make out. This is the outline of liver which you are seeing. And then we have got this as duodenum which you are seeing, and this is pancreas, and this blue color structure which I shown as portal vein. And now we are going to deal only about the part which is present outside the liver. So this portal vein, the length will be around 8 cm and width will be around 2 cm. And this portal vein we are dividing according to the extrahepatic part in 3 ways by means of the first part of duodenum. So this part is considered as first part of duodenum, which is dividing the portal vein into 3 parts, such as one is infraduodenal part, that is below the duodenum, infraduodenal part, and one which is present behind the first part of duodenum is called as retroduodenal part, that is behind the duodenum, and one which is present above, we will call this part as supraduodenal part. So altogether we have got 3 parts: supraduodenal, retroduodenal and infraduodenal part. Now we will move on to the relation, which is very easy to be remembered. First we will move on to the supraduodenal part. So supraduodenal part, if you are taking, by seeing that image you can make out this is the part which is going to enter the porta hepatis. So in porta hepatis, you already know we have got, other than portal vein, 2 important structures such as duct, which is hepatic duct, which is going to continue as bile duct, and then we have got another structure called hepatic artery. So these are the 2 structures which is going to get related in front of the supraduodenal part of portal vein. So in front we have got bile duct with hepatic artery related anterior aspect, and in the posterior aspect it is same for all the 3 parts of portal vein, that is supra, retro and infraduodenal part. Behind we have got important vein called inferior vena cava. So this is the vein which is related behind. So the relation behind the portal vein on all the 3 parts is inferior vena cava. In supraduodenal part, anterior aspect is contributed by bile duct and hepatic artery, which are coming outside the porta hepatis along with portal vein. Now we will move on to retroduodenal part, that is second part which is present behind the first part of duodenum. So here, by seeing that, why we are calling it as retroduodenal part? Because it is present behind the duodenum. So obviously in front it is related to first part of duodenum, and behind, as I said before, all the 3 parts are related behind with inferior vena cava. So that's all about retroduodenal part. In front, first part of duodenum, behind it is by IVC, that is inferior vena cava. And then we are seeing about the infraduodenal part, the portal vein trunk. It is present, you know, it is formed behind the neck of pancreas, which is present below the first part of duodenum. So in front it is related to neck of pancreas, and behind, as already said, it is related to inferior vena cava. So behind relation it is same for all the 3 parts, IVC, IVC and IVC. And in front of the infraduodenal part, neck of pancreas, in front of retroduodenal part, first part of duodenum, and in front of supraduodenal part, hepatic artery and the hepatic duct, which is going to continue as bile duct. So this is how extrahepatic part is seen for the portal vein. Now we will move on to intrahepatic part. This intrahepatic part, it is present inside the hepatic tissue or liver tissue. So after dividing into 2 branches, such as right branch and left branch, it will divide into many tubes which is going to enter a canal called porta canal. Then after it is having some course, at last it is going to get drained into inferior vena cava. So the course we can make out here: portal vein dividing into 2 branches and entering the porta hepatis. After that it is going to pass through portal canal. So in the portal canal it is again passes and then converted into hepatic sinusoids. So inside the liver tissues, this is the vein which is going to form a space filled with veins, we will call that as hepatic sinusoids. Later, this hepatic sinusoids are going to continue and form cystic vein, and this cystic vein again it was going to transform into sublobar veins between the lobes of liver. And later this sublobar vein going to form another important vein called hepatic vein, which at the later stage going to end up in systemic vein, that is IVC, inferior vena cava. So these are the process happening inside the liver tissue. That's why we are calling this as intrahepatic part. So that's all about the external and internal part of the portal vein we have got. Now we will move on to the tributaries of this particular portal vein, which is very important. So if you know the tributaries of portal vein, it is easy for you to learn the communication of this portal vein with systemic vein, which is a very important topic and very important region or drainage in our body. So you know this is portal vein, which is trunk, and then this portal vein is formed by two veins which we will consider as formative tributaries, such as splenic vein, which is coming from the left side, and from the below part we have got superior mesenteric vein. So these two veins are considered as formative tributaries, which is going to form the portal vein. Later the portal vein, it will again divide into left branch and right branch, as you already know, which is going to enter the liver tissue through porta hepatis. So these two branches of portal vein, again it is going to drain two smaller veins, such as right branch it is going to drain cystic vein, which is coming from gallbladder, and then we will be having another branch called left branch, which is going to drain para-umbilical vein. So this is another tributary. So we have got two formative tributaries and two tributaries which is draining into the branches of portal vein, and then we have got two more tributary which is draining directly into the trunk of portal vein, that is left gastric vein and right gastric vein. So altogether we have got 6 tributaries draining into portal vein. I will repeat again: splenic, superior mesenteric, cystic, para-umbilical, left gastric and right gastric vein. So all these veins are considered as tributaries of portal vein. So once we understood the concept of tributaries and where it is present, it will be easy for us to understand the communication of portal vein with the other important vein of body, that is inferior vena cava, seen in abdominal. So now we will see about the collateral anastomosis between the portal and systemic vein in detail. So we have got 7 areas for the portacaval anastomosis. Among that, first one we are going to see at the lower end of esophagus. Lower end of esophagus, we are going to see an anastomosis between portal and systemic vein. So situation, what we are seeing is at the lower end of esophagus. Lower end of esophagus is the first portacaval anastomosis happening. And now for knowing that, just we will know how the structure is present. So you know we have got liver. So we have got liver, and here we have got esophagus with the stomach part, which is going to continue as duodenum. So this is how we have got the organs placed. So we have got liver, stomach and duodenum placed, and then we have got again above the liver a part called diaphragm. So we have got diaphragm over here, and from the diaphragm we have got an opening through which our esophagus is coming. Now we are going to see about the veins contributing for that. So veins contributing for this anastomosis. So we have to see both portal part and systemic part, which is getting anastomosed to form this portacaval anastomosis. So now we have got portal vein. So we have got portal vein somewhere here, and this portal vein have got, in porta hepatis it will divide into 2 divisions. So here consider this as porta hepatis, and this is trunk of portal vein. Here we have got a vein called left gastric vein and right gastric vein, which are getting together it is these two are the major tributary which is getting drained into our portal vein. So this is portal vein, left gastric and right gastric vein. And from the diaphragm we have got one more vein coming out, that is hemiazygos vein. So this hemiazygos vein, it is a systemic part getting drained into superior vena cava at last. So we have got hemiazygos vein coming out from the diaphragm. Azygos vein, which is giving some branches, some branches or some tributaries here in the lower end of esophagus. So this is the lower end of esophagus. So in lower end of esophagus we have got some systemic veins, and then we have got some portal veins which is coming from this left gastric vein. So like this it is getting anastomosed. So we have got this as left gastric vein which is giving some branches towards the lower end of esophagus. So this is lower end of esophagus. So lower end of esophagus we have got some veins coming from hemiazygos and some veins coming from left gastric are getting anastomosed here, and this is the systemic part and this is the portal part. So this is the anastomosis happening in the lower end of esophagus. Now you can tell portal vein which is contributing here is left gastric vein, and systemic vein which is contributing is tributaries of hemiazygos vein. So this is how we have got anastomosis happening. Both will together join and form the anastomosis. Now we will see applied aspect or clinical aspect. So applied aspect for this is esophageal varices. So we have got some obstructions happening in the portal vein. So if the portal vein got obstructed, we will get a condition called esophageal varices. So it is a condition which happens if the portal vein get obstructed in the lower end of esophagus in the anastomotic channel. In that time what will happen is the patient will cause emesis of blood, that is hematemesis will happen in that particular individual. The veins will get ruptured and it will lead to this emesis. So that's all about the portacaval anastomosis happening at first region of lower end of esophagus. Now we will move on to the second region. So second region where it is happening is at the lower end of rectum and anal canal. So we have got situation that is in the lower end of rectum and anal canal. So this is the situation where we have the second anastomosis happening. So we have got rectum. So we have got rectum with inside we have got a line called pectinate line, which is a line demarcating between the upper part and lower part of rectum. Here we have got again portal and systemic vein. So the first vein which we have got is superior rectal vein. So which is a vein getting drained into portal system, and in the lower part below the pectinate line we have got some veins, that is middle I've got two pairs, that is posterior intercostal vein, and then we have got lumbar veins. All are getting anastomosed with this paraumbilical vein. And applied aspect, if we are seeing, if any obstruction happens over here, it will form a veins which are surrounding will get distended and form spokes of wheel. The condition is called as. So now we are going to see about the details of the anastomosis, portacaval anastomosis happening. As I said, we have got 7 regions. So among that I have to change over a thing. We have said 7 places for portacaval anastomosis. In previous thing I have mentioned 6th one as ligamentum teres. It is not ligamentum teres, it is in falciform ligament, which is a mistake, you have to correct it. So now we will go on to the details of each one separately. So first one where the portacaval anastomosis is happening is at the lower end of esophagus. So lower end of esophagus, here you can see some three organs such as we have got liver, and this is stomach, which is a continuation of esophagus, and here we have got duodenum. So now in the lower part of esophagus we have got both systemic and portal vein getting anastomosed. That is, from portal vein we have got a tributary called left gastric vein, which is a major tributary of the portal vein, and then we have got this as diaphragmatic part, and through the diaphragmatic opening we have got a hemiazygos vein which is coming from thoracic region. That hemiazygos vein, which is draining into systemic vein, will give some tributary which will anastomose in the lower end of esophagus. So the black color circle which I have marked is lower end of esophagus, where we have got systemic vein tributary coming from veins of hemiazygos vein, and then portal part coming from left gastric vein, which is a tributary of portal vein. So these are the veins which are getting anastomosed in the lower end of esophagus. Now these are the veins contributing, that is portal and systemic. Portal vein is left gastric vein and systemic vein is tributary of hemiazygos vein. So these are the portal and systemic vein getting anastomosed in lower end of esophagus. Talking about the applied aspect, we have got a condition called esophageal varices. So if any portal vein is getting obstructed in this region, it will cause the patient or individual to have breakdown in their vascular supply. So the walls of the veins will get broken or ruptured, which will cause emesis of blood. That is, hematemesis is a normal condition due to the portal obstruction happening in this region. So this is a condition you have to see. So while you are explaining portacaval anastomosis, first you tell where it is happening, that is in the lower end of esophagus. What are the veins contributing for that? Portal and systemic separately you have to mention, and the applied aspect of it, that is here esophageal varices. Now we will move on to the second area where this portacaval anastomosis is happening. That is happening in lower end of rectum and anal canal. So this is the rectum part. What you are seeing here is rectum. So this rectum, again it is divided by a line in the interior aspect into upper part and lower part. The line is called as pectinate line. So above the pectinate line we have got superior rectal vein draining the upper part of rectum, and in the lower part we have got middle and inferior rectal vein draining the lower part of the rectum. So this middle and inferior are draining into IVC. The superior rectal vein, it is draining into again the tributaries of portal vein, that is splenic vein. So this is how we have got the portacaval anastomosis happening in the lower part. From above the pectinate line, veins contributing is superior rectal vein, which is a portal vein, and then we have got middle and inferior, which is draining into systemic vein. So portal and systemic are getting anastomosed together here in the lower end of rectum and anal canal. Now we will move on to the applied aspect or clinical aspect. So if any portal obstruction happens over here, it will cause us internal piles. So this is the detail of lower end of rectum and anal canal. Now we will move on to the third region where the anastomosis is happening. Again, situation you know, it is in the umbilical region. Surrounding the umbilical region it will happen. In the middle or umbilicus region we have got a vein called paraumbilical vein, which is a direct tributary of left branch of portal vein. So this paraumbilical will be grouped under portal vein. Surrounding that we have got many veins which is getting anastomosed with this one paraumbilical vein. That is, we are dividing into above, in the sides and from the below. So from above we have got two sets of veins, medial and lateral. Medial vein is superior epigastric vein, lateral one is lateral thoracic vein, which will be seen on either side getting anastomosed with the paraumbilical vein. Same way in the lower part we have got medial and lateral vein. Medial is inferior epigastric vein and the lateral one is superficial epigastric vein. That is also getting anastomosed with the paraumbilical vein, which is a portal vein. On the sides again we have So we have seen how the anastomosis is happening. Now we will get into the applied aspect in the umbilical region. So this is paraumbilical vein. If it is getting obstructed, the portal vein, it will cause distended or veins pattern on the surrounding region. So the surrounding region which have got all 6 veins will get distended like spokes of wheel, and that condition is called as caput medusae. So this is a condition which will happen because of the portal obstruction happening in the umbilical region. So that's all about the details of portacaval anastomosis in umbilical region. I have to tell the situation that is in the umbilicus, at the level of umbilicus, and the veins contributing portal vein by paraumbilical and systemic, all these 6 with patch, that is on right side and left side it is going to contribute and anastomose with this paraumbilical vein. Applied aspect distincting, so the veins which is surrounding the paraumbilical or umbilical region is going to form a spokes of wheel pattern by its distended variation, and that condition is called as caput medusae. So that's all about the details of umbilical region anastomosis. Now we will get into details of other region in detail. So now we are going to discuss about the next portocaval anastomosis which is happening behind the peritoneum. So we are dealing all of the portocaval anastomosis under 3 subheadings. One is the situation. So this is the situation of this next portocaval anastomosis, that is behind the peritoneum in the posterior abdominal wall. So behind the peritoneum of posterior abdominal wall, that is retroperitoneal part, we have got another portocaval anastomosis happening. So that is between which all veins we have to see. So for that, veins contributing. So second thing we have to know about the veins contributing for this anastomosis. So here in this image you can make out some organs are there. So this is spleen, colon, kidney. So these are the organs present, and the larger tube which you are seeing is this one is IVC, that is inferior vena cava. The smaller one with dotted lines which I shown is portal vein. So this is portal vein. So now we have got this portal vein, have got a tributary coming from the spleen, that is splenic vein, and we have got some colic veins which is draining into splenic veins, and then we have got 2 veins which is directly draining into inferior vena cava, that is corresponding renal veins. So this is left renal vein, and same way this is right renal vein. Now we are going to see which are the veins contributing for the portacaval anastomosis behind the peritoneum. So we have got portal vein and systemic vein contributing for it. So in this, portal vein contribution are mainly by splenic vein and colic vein. So these 2 veins is going to communicate with systemic vein of left renal vein, and also some tributaries, that is direct tributaries coming from inferior vena cava. So this is how we have got anastomosis happening. Some direct branches also coming. So this is the anastomosis happening which is between the portal vein. So this is whole thing is portal part, splenic and colic part. So from here we have got some branches coming from inferior vena cava. So these are the smaller branches which is coming arising directly from or getting drained directly to the inferior vena cava. Those tributaries along with left renal vein is going to anastomose with these 2 portal veins. So left renal vein and direct tributaries of inferior vena cava. So these are the portal and systemic vein which are getting anastomosed together behind the peritoneal part. Here we have got a special name for the direct tributaries of inferior vena cava, which we can call that as veins of Retzius. veins of Retzius. So this is the name or special name given to the tributaries of inferior vena cava, which is communicating directly with the IVC, or it's just draining directly to IVC and getting communicated with splenic and colic veins. So this is how another portacaval anastomosis is happening. Now we will move on to next anastomosis, that is we have got in liver 3 types of anastomosis happening. So we are going to see in liver 3 anastomosis are there. One is in the bare area, another one in ligament, falciform ligament, and another one at the fissure of ligamentum venosum. So these are the 3 areas we have got anastomosis happening in liver region. So first we will move on to bare area of liver. So in bare area of liver, so again we have got liver. So this region is considered as bare area. So this is the bare area of liver. In the bare area of liver we have got anastomosis happening. Before that, above the liver we have got a organ present, that is diaphragm. So this is diaphragm which is present just above the liver region, and this part is considered as bare area of liver. Here we have got some portal veins and also some systemic veins getting anastomosed. So first one, portal venous, we have got here porta hepatis, and here we have got veins, branches, portal vein branches, which is again dividing into some more branches that we will call as portal radicals. So these portal radicals, it will reach the bare area. So after reaching bare area, it is going to anastomose with diaphragmatic veins. So we have got from the diaphragm some veins, that is diaphragmatic vein, which is getting drained into systemic vein. So from this diaphragmatic vein, we will be having some smaller veins arising to get anastomosed with this portal radicals. So these are the portal radicals, and this is the diaphragmatic vein and their tributaries. So these two are getting anastomosed in this bare area of liver. So this area is called as bare area of liver, where we have got anastomosis between portal veins, that is portal radicals, and systemic vein coming from diaphragmatic vein. So situation at the bare area of liver, and the veins contributing are diaphragmatic and portal radicals. Now we will move on to the other region, that is in falciform ligament. Falciform ligament. Falciform ligament. So in falciform ligament, in that region we have got again portal and systemic vein communicating. So we have got liver again. So in liver we have got a ligament called falciform ligament. So through the falciform ligament we have got a vein transmitter, that is para-umbilical vein. So we have got a vein called para-umbilical vein, and this para-umbilical vein is getting anastomosed with the diaphragmatic vein. So as you already know, above the liver we have got diaphragm, and from the diaphragm we have got diaphragmatic vein coming, which is getting anastomosed with para-umbilical vein. You know, para-umbilical vein is nothing but the vein which is getting drained into left branch of portal vein. So this is falciform ligament. So the ligament which you are seeing is falciform ligament, which is dividing the liver lobe into two, right and left. So in the left branch of portal vein we have got a tributary coming, that is para-umbilical vein, which is getting anastomosed with diaphragmatic vein. So this is systemic, and this is portal. Here this is systemic and this is portal. So this is how the other portocaval anastomosis happening in falciform ligament. Now we will move on to another area which is persistent only in infants. So we have got another anastomosis happening before birth, that is in ligamentum, fissure for ligamentum venosum. So ligamentum venosum, in the fissure we have got one more anastomosis happening. Venosum. So here we have got again a branch of portal vein. So you know we have got right branch and left branch of portal vein. Left branch is usually larger. So this is left branch and this is right branch. So this left branch of portal vein at porta hepatis, it is going to communicate at the region of porta hepatis itself. So ligamentum venosum situation of anastomosis is at porta hepatis. Porta hepatis. So in porta hepatic region, it is entering and dividing into two branches. So after dividing the left branch, while it is getting divided, while entering only it will get divided. So while it is getting divided, it is getting anastomosed with another vein coming from inferior vena cava directly. So we have got inferior vena cava. So from inferior vena cava, some direct branches will get communicated with the left branch of portal vein. This is portal vein. So that's all about the details of portocaval anastomosis happening in the regions of liver such as bare area, which is first one, and then we have got falciform ligament, and then in the fissure for ligamentum venosum. So this is how anastomosis is happening in the liver region. Thank you for listening.